You mentioned in the soul health that you use the soul health model every day with your clients and for yourself. Mm-hmm. Could you say a little bit more about that?
Sure. I look at people as a whole system. I think a lot of psychologists probably look at just what's going on intellectually or cognitively. Personally, I think that working with clients, I have to see the whole person. I have to work through what all is going in their lives. So to me, the soul health model provides the framework to be able to assess their life and also teach them how to assess their life. I always have a model by my chair so that I can pull it out any given time and just point out to them, okay, which branches do you think are working for you, which ones aren't? And because so many people are visual learners, just pulling that out for them is a teaching tool. Mm-hmm. But then also showing them about that interplay between each branch and how they all connect together helps them connect dots that they might not have originally done. Mm-hmm. I work with a lot of emotional eaters and a lot of eating disorder clients, and the model seems to work really well for them because emotional eaters don't always know why they're emotionally eating. They just do it. But bringing that out and showing them, oh gosh, I'm eating because this branch is not fulfilled, so I'm trying to feed something other than my soul. And so they eat to feed themselves rather than if they were to look at what part of the model needed to be fed and fix that, then their emotional eating generally goes away. So it can be used for really, to me, any client I work with, it's a perfect blueprint. It's just everybody's tree looks a little bit differently. And in my own life, I'm constantly assessing what's working and not working, both because I want to be the best model I can, but also because, just like anybody else, I want to experience the most radiant health. I want to feel aligned at all times. And when I'm not feeling aligned, I may be able to work a little easier on it because I know how to align. I've been doing this for years, but it does not mean that the human condition doesn't get me too. Mm-hmm. So I use it every day with clients, workshop participants, and also, obviously, myself.
So the model itself is a holistic model. Mm-hmm. But in our current healthcare system, it seems that there's very little holistic approach to medical care. Mm-hmm. So how do you see your model informing the healthcare system that we have these days?
Well, I've been lucky enough in the last year to 2 years to actually present this model to healthcare providers as continuing ed workshops. And it is well embraced because I think people are becoming much more aware that healthcare is disjointed. It's not continuous. They don't look at the whole person. They don't have time to look at the whole person in a 5 or 10 minute appointment. However, these healthcare professionals that I've been teaching are starting to really embrace that they really have to look at the whole person as well. And so I've been doing lots of continuing ed workshops on different angles of the soul health model, and we'll be doing many more. But yeah, I think healthcare itself is so disjointed. Larry Dossey, who supported the book and endorsed the book, basically emphasizes the fact that the soul really needs to be resurrected as part of healthcare. And as he endorsed the book, he basically said that's the soul health model and soul health, the book, puts the soul back to its rightful place. And I agree with that because way back in ancient cultures, they looked more at the whole person, but in modern medicine, we've really kind of dissected our health to the point where the parts don't fit together anymore. So to me, it's a vital and necessary part of where healthcare has to go in the future.
So in the meantime, how can we as individuals, incorporate this in our own proactive healthcare, ongoing healthcare?
Well, and I think again, it's awareness based. It's learning about each one of the branches that affects our true health. it's a systemic kind of thing, so if people realize that if fixing one, they fix others. So learning the model. As I said before, the book has lots of exercises, questionnaires, things like that. But even just getting used to the model and reminding yourself of the model. I have a client who actually has the model posted in her laundry room. So when she's folding laundry, she looks up at it and is just sort of assessing what she needs to work on that particular day or that particular week. I have other people who have it on their fridge, or people who have a smaller one in their wallet, or so just really the reminders, because once you learn the model, you can just pictorially look at that and go, okay, that branch or two branches need a little bit of tweaking or a little bit of work. So it's staying conscious of it and looking at it from that sort of holistic, comprehensive perspective. I started adding those branches and creating a model to include those 4 branches. And as that happened, it was